Hey guys, and welcome back to XO Medical Spa. It's been a while since we've done a YouTube, but we've been super busy here at the practice, so we're finally getting back into it. So don't forget to check us on IG Live for every second Tuesday of the month at 6 p.m. Pacific Standard Time for Leaders 30, which has been a really popular segment. So if we're not doing videos there, then we'll come back and do YouTube videos here. But today, let's talk about PDO Threads again. So that's one of the biggest things that we do here at the practice, and then me as a provider, I can't really say how big our practice is just yet. We're about to be announced. But we are top 3 when it comes to Orange County, and then me as a provider, I am top 3 when it comes to Nova Threads out in San Diego as well. So once they announce something, then I'll do something a little more formal. But one of the biggest questions I get here at the practice or when I do a consult is, how many threads do you use? And oftentimes it's a longer explanation in regards to that, but let's return in a moment and discuss how many threads I truly use for a typical patient in the face. I can't speak for how other people do PDO threads, but oftentimes what I see on what is popular now on Netflix, I see it on YouTube, is people are always concerned about just the pulling threads, also known as barbs, cog threads, whatever the case is, but it's those long, spiky threads that people see in regards to the lifting. Rarely do I see people use the smooths, the twists, or when clients ask me how many threads I use, they're shocked by the number that I give them. Because again, I think the only thing they see or what maybe other providers do is just the pulling threads. And we'll talk about that as well when we come back. So for me, mostly I use is Nova Threads, that's the brand. They make PDO threads. So for Nova Threads, they have barbs, they have the new Infinity molded threads, they have twists, and they have smooths. So I'll cut away to a picture on 3 different types of threads, and then maybe I'll find a picture on the Infinity threads as well, which I have a description I'll link to on previously where I spoke about Infinity threads. But barbs are the ones that pull. Those are the ones that people see get tunneled all the way down and they lift back up. Smooths, if you take a piece of dental floss and you just cut off 1.5 strips of it, or 1.5 inch strips of it, 2.5 inch strips of it, they come in different sizes. That's what smooths are. And then lastly, twists are smooths, but they're coiled. So again, I'll show a bunch of pictures up here in the corner. But those are the 3 types of threads I use. So barbs to pull, smooths and twists are for me to build the foundation of collagen. So if I'm just pulling, in 6 months when the PDO threads are gone, probably your results are gone. And that's the common complaint I get, or the fear that people have is, sure, it works in the meantime, but in a couple months my results are gonna be gone. And I find that's probably the case, is if you're just using the pulling threads, you'll leave the office looking fantastic. But long term, if I'm not building that quality of skin, if I'm not building your collagen, then your results don't last 1.5 years to 2 years. So the way I do it is, yes, I'm gonna lift everything back and up, but after that, I lay a whole meshing of smooths and twists everywhere. So in the nasolabial folds, in the marionette or deep folds, I'll put the coiled ones, the twists, and then all over the soft tissue here, I wanna build that collagen netting, so I'll put smooths everywhere. So commonly what happens is if you see the aging process, everyone ages the same way. We lose bone, fat, collagen, and a component of muscle as well. So all you have left is skin. So that skin drives forward and it drives down. So if you look at people who have are up there in age or don't have a lot of volume, you'll see hollowing back here. You'll see hollowing here. So if I just lifted everything back, granted the skin is gonna be lifted, but I haven't addressed the hollowing, I haven't addressed the collagen loss. So that's why for me, I'm using anywhere from 40 to 50 threads just to do this mid-face area. So when I tell someone 40 to 50 threads, are oh my goodness, either one, they've done PDO threads in the past and they've gotten 8 to 10 threads. Or they're new to it and they only see the pulling threads online or YouTube videos, and once again, they're seeing 6, 7, 8 threads placed, and they hear 30, 40, they're just shocked. The other piece of when Cheyenne at the office gives a quote and we're quoted so much higher, well, I can't say so much higher, but they have a price in mind in regards to how many threads. So if they're seeing 8 to 10 threads and they get a certain price, they're like, why are me as a provider, why is us as a practice charging so much more? It's not because we're charging more, we're giving you the appropriate treatment. With Botox, with fillers, whatever the case is, you're quoted for X amount of units of Botox, you're quoted for X amount of syringes of filler. You may need 6 fillers, but you only want to pay for 1 filler. Sure, you'll get a result, but not the end result that you get. So for me as a provider, if I'm doing PDO threads in this area, I want your results to last 1.5 to 2 years. I want your skin to look better. I want those wrinkles to go away. I don't want to just lift you, make you look good for a couple months, and then send you on your way. The totality for me when it comes to PDO threads, lifting, collagen production, improvement of skin, and overall glow. Those are all the factors that play in regards to PDO threads, and why am I one of the biggest providers when it comes to PDO thread or Nova threads, is because I do it the right way, and I do it in a manner that gives you full correction. So to recap in regards to how many threads I use, right? 40 to 50, just in this facial area. Once again, it depends on your age group. It depends on what we're trying to fix, and really is that skin quality. So if you come to me in your 20s, sure, I'll use 20, 30 threads. Come to me in your 40s, 50s, to 60s, I could be pushing 40, 50, 60 threads by the time we're done, including the follow-up. So 30, 40, 50 threads, that's how many I use, and hopefully that demonstration that I showed earlier really describes how we do PDO threads here and as a practice, and then as a provider itself, or as a provider. So if you have any other questions, please comment below. We'll do plenty more PDO threads, and don't forget to check out Leaders 30 over on IG Live, and then reach out to us for trainings as well. We do hands-on training, small classes, 1 to 2 people. You bring your own clients. We do fillers, Botox, and PDO threads as well, okay? So don't forget to give us a thumbs up, give us a like, comment below, and then subscribe and hit that notification icon as well, because although we're trying to do weekly videos between the Leaders 30 and the trainings that we do here, sometimes we don't get to these YouTube videos. And then let us know what you want to hear as well in the comment below. So happy holidays, everyone. We'll see everyone in 2021.